Hello, and welcome to this episode of In Discussion With from Medical Update Online. Today, I'm talking to Professor Derek Stewart about the work of the European Society for Clinical Pharmacy. So please, could you start by introducing yourself?
Good morning, Christine. My name is Derek Stewart. I'm delighted to be here with you this morning. I have a number of different jobs in a way. My academic position is that I'm Professor of Clinical Pharmacy and Practice at Qatar University in Qatar, where we deliver our pharmacy program that's accredited through Canada. I'm also visiting professor at Robert Gordon University in Scotland and at the Royal College of Surgeons of Ireland. But I've got two other sort of linked posts, which I'm sure you're interested in today. One is that I'm President of the European Society of Clinical Pharmacy, and I'm also the Editor-in-Chief of the International Journal of Clinical Pharmacy.
And can you give us a brief overview of your role as President of the ESCP?
As President of the ESCP, I lead the General Committee, which is our strategic committee. So my responsibility is really to lead the strategic development of the society and also look at the implementation and evaluate the outcomes of that strategy. Our strategy at the moment is 22 to 24. This year we will start to revise that. We have four linked operational committees. We have a research committee, education committee, communication committee, and a special interest group council. And we are then in the general committee responsible for reviewing their annual plans, making sure that they align and that there's coherence with the strategic plan, and then looking at the implementation and the outcomes of those plans.
Now, you have been President of the ESCP since 2020, and before that, Chairman of the Research Committee. And I want to explore a bit about what the Society does, what it offers its members, and where it's going. Can we start with who is eligible to join the ESCP? Do you have to be a clinical pharmacist?
Not at all, and we really stress that now in all our communications. Our members are anyone with an interest in clinical pharmacy. So that might be clinical pharmacists, pharmacy technicians, academics, students, but also we would welcome non-pharmacy professionals, patients, anyone who's got an interest in really advancing clinical pharmacy. So no, you don't have to be a clinical pharmacist. Most of our members are, but we are really trying to advance the other parts of the membership, because it's really important that as a team, a pharmacy team, we deliver clinical pharmacy. It's not just clinical pharmacists.
And what do members get?
Many things. And one thing we've really worked on over the last 2 or 3 years is really articulating the member benefits a lot more. So one key thing is to become a member of a sort of dynamic, powerful society. It's not just a European society, it's a Europe in the title, but we are a global society. And really to become a member of that society, really harness all the developments in clinical pharmacy and be able to support countries which are at the earlier stage of that development. So that's one key thing, is really that network, that expertise sharing, and encouraging all our members to be part of what we do. In terms of the member benefits, we do reach out to the members to find out what are the needs, what do you want us to be doing. Some of the other things that we deliver, we have monthly webinars. We set the webinar program based on the needs of the members and what they tell us they want. So we do some work every year through our education committee to scope what did we do last year, what would you like us to do next year. Those are free for the members. We also welcome non-members at a very reasonable price for those. And they're a mixture of pharmacotherapy, research methods, educational methods within that. We also offer generous discounts for our events. So we do 2 major events per year. Every April, we have a 2-day international workshop, which is focused in a particular therapeutic area. So this year we were in Antwerp in Belgium in April, focusing on diabetes and cardiovascular comorbidities. Our bigger event in autumn of every year, around about the end of October, is a 3-day international symposium, which is much wider in its scope. So this year we are in Aberdeen in Scotland around innovation. So any innovation in clinical pharmacy in terms of practice, education and research. And actually the discount we offer is more than the member fee. So that's a really important thing to think about. We also are affiliated with the International Journal of Clinical Pharmacy, and our members get free access to the journal and also a sister journal called Drug and Therapy Perspectives. We also have a number of special interest groups. Now, the special interest groups are really dictated by the members. It's not the general committee. We do not decide the special interest groups. And our members are welcome to join as many special interest groups as they would like. We also put out calls for best practice papers, which are really best practice in innovation in clinical pharmacy, and those that are accepted are eligible for publication as full papers in the International Journal of Clinical Pharmacy. We're also looking to reintroduce our research grant, which will be available for our members as well. So yeah, lots and lots of things that we're now offering for our members. And our website, we refreshed our website last year, and it now really clearly spells out, come and join us, look at what you get for that member fee.